Hi, Lynette. I know we know each other already, but just for purposes of the interview, I am Dr. Florianne Fair, an associate professor at Thompson Rivers University, and I'm going to ask you some questions about your experience surviving cancer. And but you already know me, so I won't get into too much boring details. But I think the audience out there would love to know about you.
Well, thank you. I'm Lynette Nordic, and instructor here at TRU, also in the School of Nursing. And I was happy to have yourself and Melba invite me to this interview.
Right, and I can't thank you enough for taking part in this interview because, and I know how open you are about your experience with cancer, and it's just so important to share your story. So, really, really grateful and honored that you're willing to share, and the information that you're giving us will be so important for others to hear about, and also better understand as healthcare professionals, sort of what's going on in people's minds when they're making decisions, when they're given a new diagnosis, and that's sort of my big question, is just to find out. From you, once you were given that diagnosis of cancer and maybe given some options for treatment or however that conversation unfolded, sort of what went through your mind and what did you prioritize? Like, how did you even just try to sort it out in your mind with what to do with that information and maybe the treatments? It's a big loaded question.
Yeah. So it brings me back to the day that I was diagnosed. At the time I had taken, it was essentially about a month from the time I went into my physician's office to say, hey, I think you might want to check this out. He didn't think it was too much of anything to worry about. And so a month later, a biopsy. I was scheduled for biopsy, and then 2 weeks after that. So essentially 6 weeks from sort of the time when I got the ball rolling to investigate. And it's coming up to an anniversary when I did get a diagnosis, which was July 31st. 2014, so it was a while ago, but it's definitely in my mind. I remember it well. You never want to get a phone call from a physician, a physician's office, who says, yeah, we need you to come in, and it's could you come in a couple hours? So my husband and I went. It was about 2:30 in the afternoon that day, and received the diagnosis, and of course, very emotional diagnosis. But right from the get-go, I could say I was probably up for a challenge. Strange to say. There was a lot of emotion, like I said, lots of heart racing and tears. But it was, I felt like I needed to get working on the problem.
Right.
So away I went and started looking at how I can manage it, how I could have the cancer removed, how soon it could be done, where it could be done, here in Kamloops. And from there, I went to, I actually discovered that the physicians many of them were on holidays. Being the summer, many of the surgeons were on holidays. So once I discovered that, I decided to make my way down to Vancouver via the internet, come up with some solutions, and for other places or other surgeons that could help me.
Right, you were very resourceful, and you have that advantage. You're a nurse. I don't know if it is an advantage, but you kind of know the system a little bit, perhaps, and who to call.
Yeah.
So you right away went into action and prioritized. I got to get treatment. I got to find out how to get it as soon as possible.
Yeah, absolutely.
I see you grabbed your husband in there.
Yeah,
for the actual big meeting to hear the news. And then what other things were you going through your mind then too?
First and foremost, the children, the boys at the time. So we have our oldest boy at the time was 16. We have a set of twin boys that were at the time 13, and that was my priority. That was where a lot of my emotion came from. I immediately thought about what are the boys going to do if the prognosis is poor, and what are they going to do without a mom, and that they were my priority. So that's where a lot of my energy and motivation came from, to be able to have this tackled quickly and effectively. Yeah.
And again, I mean, this is tough to talk about, even though it was 2014.
Yeah.
It probably feels like yesterday because that's such a huge thing to be told.
Yeah.
And then you're rushing through trying to get all of these ducks in a row, cliche.
Yeah.
Get down to Vancouver, and then you're offered some treatments.
Right. Yeah.
So how did you decide? Like, how did you prioritize what you would pick and do? And I mean, how did that all happen? How did that unfold?
Actually, really, it ended up being fairly easy what I was going to, how I was going to choose to manage it, simply because it seemed like it was going to take a while for me to be able to get into a OR here in Kamloops, because of having to wait for the surgeons that were not in their office over the summer. So my GP was able to contact a surgeon down in Vancouver, of which I gave him a couple names for him to contact. So I did the research, yeah.
You were really getting control over
Yeah,
it.
so
Right,
that was,
okay.
you mentioned the benefits of being in this system, or understanding the system, being a nurse. That was, I found, helpful for me, because I was able to resource a lot of information, whether it was books or internet sites that were, solid internet sites.
Right.
And then search out a surgeon in Vancouver. So off we went, and a good friend of mine and I went down, and I was able to secure a surgeon and secure a time to have the surgery completed, which was going to be, of course, sooner down in Vancouver than it was going to be here. So that was a fairly easy choice, because I just wanted to have the cancer removed.
Right. So it didn't really matter. Your priority was the timing of it. It didn't matter that it was here in a rural area in Kamloops. It was, you were willing to go anywhere because time was priority.
Yeah. And that was a benefit of being in I'm going to call it a privileged situation.
Yeah.
Not all cancer patients would be able to take the trip financially, or utilize, their precious time to go travel down to Vancouver. They may not have all the resources. I was in a position to do that, and I felt I was privileged to be able to do it that way. And it turned out being very successful, and I didn't require any chemotherapy. I simply had I say simply, I had a double mastectomy, and with no complications, and the surgery was September 9th, 2014, and I was back to work November 18th here at the university. So I count myself very, very lucky. And
It was a quick time.
it was very quick.
It happened so quickly because we were working together.
Yes.
And first thing, you get this diagnosis, you're gone, you're back.
Yeah.
And it's like, what just happened here? What a whirlwind. But even, and again, you make some pretty good points. You have a job, but it's flexible enough that you can take off and leave, and financial security that you can actually go down and go to another place.
That's right.
And so your priorities are, I have time. I'm going to look at time, and I'm going to just get it done. And then you had this background piece about you're going to do it fast because you've got these beautiful children and a family, and that's what's really getting you to, I'm not going to die.
Yeah, exactly. Very motivated, and I had, very determined that I was going to beat this, and I didn't have anybody. Made sure that nobody else told me any different. So, I was very focused on the end goal.
You're on a very strong path of survivorship. Okay. When you went through that, though, yes, you had the money, you had the time, you could go down and get this done. Is there anything, if you were to go back in time, that you would say, I would also want to support me, to make this even a better experience? And even if you were someone else that didn't have all these privileges too, as you call them, what would you say would help?
Probably someone to speak to in the moment. At the time, the only thing that I found available to me was to call a 1-800 number through, I believe it was BC Cancer Association. And I could speak to somebody who had gone through a similar situation. So that was helpful.
That's
yeah, it would have been nice to have maybe a support group here that you could connect with, or some other type of maybe nurse navigator for diagnosis of cancer or breast cancer specifically. That would have been really helpful. What also did help me through that process was friends of friends who knew somebody in their friend circle that had gone through breast cancer.
Right.
So then you make those phone calls, and those are helpful.
Yeah.
Coming from the person
they've lived it.
Yeah.
I get
And
it.
it may not be the same type of breast cancer, but it was helpful to be able to speak to them about how they navigated their cancer journey.
Right, because it's such an internal experience.
It is. It is.
Right, we can't read your mind. We don't know what you're going through. We can pretend we think we do, but
Everybody's situation is so different, and how they made their choices about their treatment, where they had so many decisions that had to be made in really quick really quick time. And you also have the physicians, and the surgeons are there to provide you with what I discovered, a lot of statistics and facts. I found that helpful at times, wasn't always what I needed at the time. I think what I really needed as being a nurse, I think I needed a nurse.
you needed a nurse.
I needed a nurse.
And you need somebody who had gone through it before to give you a heads up, and also just sort of be in that zone with you. Of, this is scary. This is like, we got, when there's this urgency for time. And
Exactly. Something I do want to point out, speaking of nursing, is that I had, there was one nurse that I had, it was a nurse down in Vancouver who I spoke to. She was part of my admission team. So I had to go down on the Friday, and my surgery was going to be on the Monday. And on the Friday, I was still scheduled to be able to have the double mastectomy and reconstruction at the same time. And that's the way they had essentially, that was their procedure down on Vancouver Coastal.
yeah, okay.
Yeah, which is very different than what it was here at the time. So I wasn't interested in reconstruction. I just wanted the cancer taken care of, and that was more than enough for me to think about. What was really great is that nurse took some time to listen to me and really recognized how important that was to me to not have to have the reconstruction, make that decision at that moment.
Right.
And so she really advocated for me on that Friday afternoon.
Oh, wow.
Before my surgery the following Monday morning.
Yeah.
So it's supports like that were really helpful.
They're there in the moment when you really need them, but they also get it. They get that you have certain things, even if there is a protocol or some kind of process, you want to have that choice and that option.
That's right.
And be heard.
Yeah. And as much as the physicians and surgeons believe that what they're doing is the right thing, it was really important that they listened to and understood that I knew my body the best.
For sure.
And they...
You know you.
Yes, and it was I have to say, it was that nurse that was very helpful to me in helping me navigate my final decision.
For sure.
And of course, the friend that went along with me, saying that I needed to stand firm in my decision.
Good on you.
Yeah.
And it was a blessing in disguise that you were a nurse.
Yes.
And you could figure these things out along the way, and the timing of it all. Wow, I'm just so glad you're here and to share this story.
Well, I'm happy to be here and share this story, and it's if it can be of any help to anybody, that's what's important. I don't mind having conversation about it.
Well, I'm certainly hearing that if somebody says they want something, you need to advocate for them, and because it is their life, it is their world, and they know what their priorities are.
Yes.
And having that 1-800 number is great, because sometimes it's like 3 in the morning, you need to phone.
That's right.
Right? And it's you thinking about it and talk, and yeah, you need somebody to talk to you right now.
And it's those times
Yeah.
in the middle of the night where you're thinking the most
Right?
about what to do. Yeah.
So that's good to hear that exists, and having a nurse navigator. And I wish here in Kamloops we did have a nurse navigator, and somebody that
A team.
yeah. And that's the tough part when we're in these small towns.
Yeah.
I can't thank you enough for just sharing your experience with us, and I know it's a very emotional thing to think about what happened back in 2014, but it does carry through. For your whole life you have a story to share with everybody, and I just appreciate you don't mind doing it on a film, and yeah, I thank you so much for being part of this interview.
I'm honored to have been asked. Thank you very much for including me. And if there's any way I can help anybody else, I'm always happy to have the conversation about my experience.
Hi, Tracy. Thank you so much for taking part on this filmography we're putting together. I'm Dr. Florianne Ferry. You haven't met me yet really formally, but part of the research team. And again, I just thank you so much for spending some time with us and sharing with our audience your experience with breast cancer. And yeah, I have one very big specific question, but we'll see where it goes. First of all, just curious if you can share what your experiences were like when you went through breast cancer and used the healthcare system itself.
Sure. The diagnosis was in 2018, and that was, I believe that was in February. And so had that mind-blowing experience. And then in working my way through the medical system and started chemo as soon as we could. And then I had 21 rounds of chemo, 28 rounds of radiation, and 2 surgeries. So my first surgery was a mastectomy on the left side with the removal of my ovaries and a lymph node. After radiation, my surgeon said, I really feel we should take the right side. And I said, yeah, I think you should. That's what I said at the initial setting. So, so that's what we ended up with is a bilateral, if that's the correct bilateral mastectomy. Overall, I think I can't look back at that experience and say that was awful. As to the treatment I received, my surgeons were just top notch. My surgeon said, I'll take care of you. And I said, I put my faith in you. And she was phenomenal. So the nurses at the clinic, cancer clinic, were fantastic. And the wound clinic. So after surgery, I would have to go to the wound clinic for care, and as well as my regular blood work, and the staff there was great. The only things that really were troubling was the travel for radiation. Kelowna has the clinic which offers radiation. So for 28 days, I took the Masons, the Freemasons have a van, and they pick you up and they drive you there Monday to Friday. And there was usually 3 or 4 other folks that had to have treatment too. So these gracious people would drive us Monday to Friday, and you would go in for your 15 minutes of treatment, and then you'd sit and wait for the rest of the folks to finish. And fortunately, the clinic there had us on a pretty tight schedule so that we didn't have to wait around too often for other folks. But if I'd had to drive myself or expect a family member to do that, it wouldn't have happened. It was why we don't have that service here is beyond me. It's a real shame that it's not here yet. I can't imagine if I didn't have that resource to take me. And there may, like during COVID, there were other folks who, I'm assuming it was, well, I know treatment wasn't offered for a while, but when it was back on, did the Masons drive those folks? I don't know. So I was really grateful for that service, absolutely. So I think there was a lot of, you spend a lot of time in the hospital and you have a lot of appointments and you deal with a lot of folks. And for myself, I just accepted this was my situation, and I would do what I would call disengage, take in the facts, process them, and do what I needed to do to get the job done. Is how it went for me. And I think all in all, things have gone very well, as can be expected. Yeah. So my initial diagnosis was 2018. It's now 2023. So I have what I call my, call it maintenance. I go in every 6 months, have blood work, see the oncologist, and have a treatment called, because as we're sitting here, I've lost it, zoldronic acid, if I've got the name right, 15 minutes. No problem, I can go right back to work and do what I need to do. And I'm actually doing that, well, tomorrow I'll see the doctor. So today was blood work, tomorrow I'll see the doctor, and then the next day I'll go in for that treatment. And that is my second last one of those treatments. So that's pretty awesome. Yeah, looking forward to that. At the same time, I feel a little hesitant in that I will lose that 6-month support of seeing the doctor. I am fortunate in that I have a family doctor. So when you diagnosed, you are assigned to whether it's a nurse practitioner, I believe, or a family doctor at the initial diagnosis. And so I actually was assigned to a nurse practitioner, and for my purposes, she was not a good fit for me. I don't think it had anything to do with that she was a nurse practitioner. That wouldn't have been a problem for me, but we didn't have a fit. So I chose to not see her, and I lucked out and I found a family doctor on my own, which was really, really neat to do. I was really grateful for that. And I'm still with her, and she takes good care of me too. So yeah, and so here we are today. I'm doing pretty good.
That's just incredible.
Thank you.
Way to go, Tracy. One more to go after this.
Yes, yeah.
I can't imagine. I'm hearing your journey. It's just the amount of waiting that you had to do for others, and the amount of different interactions of caregivers, different services along the way to get there, from the bus to the actual clinic, the back and forth. Incredible what you've gone through. And this is the extra layer, the extra barrier, I guess, if we live in a rural area, don't have our own cancer center. But you went in with it with an open mind, it sounds like.
Yeah, I think so.
Pretty incredible what
you.
you've done and what you've gone through. And I just can't thank you enough for your stories. The other piece that I would like to sort of add, though, or a question that I'm interested in is, while you were doing this waiting, while you went in for these very short periods of moments of time to have a quick turnaround and then go back home again, what would you have wanted the healthcare professionals to know additionally, maybe just to help with the process for you? Is there anything now when you look back at it that maybe we need to know?
Well, I guess one thing for certain is, and as I had mentioned already, we need to have radiation treatment here in Kamloops, without a doubt. Why that hasn't happened, can't imagine. I'm sure there's some political reason why it's not in place. Honestly, I feel the majority of the nursing staff that I dealt with, they were great. I can't think of a person who I thought badly of. I know going into Kelowna, sometimes my chemo treatment days would fall on I think I had 2 that happened, of course, at the same day I was going for radiation. So the staff there would organize it so I would do one and then the other. And that clinic, their chemo clinic there, was just a packed house. And I really felt for that nursing staff. Like, people, it was wall-to-wall people, and they just business as usual did their work. So I really appreciated that. And, you know, when you think about that, going there to Kelowna, there were options for housing, but the option was to share accommodations with another person. And, you know, that wasn't an option for me.
Yeah.
A person I don't know, and we're probably both feeling poorly. Do you really want to share a room with somebody? And if you think about it, I'm here for 15 minutes of treatment, and you're offering me to stay here for 5 days, away from my family, away from my kids, my home, my pets. It's just, I think if perhaps somebody at a higher level was told that's what you've got to deal with and experience that, perhaps there would be a quicker movement in getting things changed. I think something that I think of often was when I first started chemo, I also visited a naturopath, and he gave me some vitamins and some supplements and such to take, and I shared all that information with the cancer clinic, and the pharmacist there, I can remember his comment to me was, "You've made me, I've had to create a whole big binder based on your file." And he was pleasant, but he was slightly annoyed, and agreed in the end. I think he thought he sort of poo-pooed what I was doing and said, it's fine, it's harmless, you can continue on. So that was great. I also was, when you receive a diagnosis, you're willing to try many things, right? And absolutely, I was always willing to do whatever the oncologist said, this is what we had to do, and if it was reasonable to me, I did it. But I was always looking for another avenue. And I also initially was taking THC, and that I could see with some of the staff, it was a bit of a joke, and that's okay. There was nothing anyone could say to sway me from doing that. And eventually I found I didn't enjoy the effect of it, how it made me feel. So I switched over to CBD and took that for quite a while. And I would definitely suggest anybody give that a try. I think it helped me quite a bit. I think something that really important, some of the side effects of chemotherapy, one of the chemotherapy courses I went through, the doctor was very blasé about how this was going to make me feel. Said, you know, I can give you pain meds, but you probably won't need it, and you're going to have some minor joint pain. Well, that was not the case at all. And because the doctor said, you know, it's probably not a big deal, I said, okay, I guess I won't worry about the pain. And chemo was on a Thursday, and then by Saturday, it didn't kick in until 2 days later. I thought, I've been hit by a truck. The aches, the pain was quite horrendous, and it would last about 2-3 days. And finally, I called the clinic and said, explain the situation to the nurse, and she said, oh yeah, you should have something. So it's really, while I understand perhaps the doctor doesn't want to make it sound awful, but at the same time, let's be realistic in what you're sharing, because it was really quite painful. When I started to take letrozole, the doctor said, same thing, you're gonna feel some minor discomfort, you're gonna feel some aches and pains. No, it's way more than that. And the best way I could describe it was, as I started to take it and continued on, it felt like, I didn't know how else to say it, it felt like a cold blanket settling over my body and my bones and joints. And so there were times I was thinking, why do I feel like this? What is happening here? And I was having pains in my elbows. And, you know, the doctor was just sort of dismissive of it. It was suggested to me to see a massage therapist, one of the locals here in town who also takes care of folks with lymphedema and such. And I remember going to her and talking with her about it, and she said, that's the letrozole that's making you feel that way. And it was just a little light bulb, and I went, oh. And it was, it sounds hokey, but there's power in knowledge. Just knowing that this stuff's going to make you feel this way very specifically was really helpful to know that. So, and it settled out in time, but there was a time in a cancer clinic where in the waiting area, the pharmacist was explaining to a lady and her husband and son who was about to start taking letrozole about how this works and how you're going to feel, and he was very dismissive of the side effects. And after he left, I went over to her and introduced myself and told her, this is my experience. Yeah. So, just so you know how it was for me. And she wasn't quite sure how to take that, but she thanked me. And then the pharmacist came and I thought I better leave, but he didn't say anything. He just gave me a bit of a look, what are you doing? So those are things that, of course, they, especially if it's a male doctor, they haven't had that experience. So they can't speak to it directly. And even as a woman, a female doctor, they may not have experienced that either, but really important to understand what your patient is experiencing and not to be dismissive. I'd rather have the truth, the broad range of it could feel like nothing, or you could possibly experience this. Give me the goods so I know what I'm dealing with.
Right.
Yeah. I'm not sure if there was anything else. After my surgery on my mastectomy on the left side, your muscles, and I also had a lymph node removed as well, so quite tight and sore. When I made the trip to Kelowna for my initial visit with the doctor there, and somewhere there was a misstep because I can't remember, it was 2 or 3 weeks between surgery and that first visit, but she was asking me how was my physiotherapy going, and I don't know. I said, am I supposed to be in physiotherapy? Because when you receive radiation treatment, your arm needs to be up above your head. And initially after surgery, I could not do that. It's just too tight. So fortunately, I had some time between that visit and the first treatment where I could work at some exercises and get my arm as back as possible. But I didn't know. And I said, well, who is supposed to share that with me? And I still don't know who is supposed to tell me.
Multiple people again, all with
Yes.
different angles and responsibilities, but
Yeah.
some missed information along the way.
Right.
And you wanting to have it all, because then it's your choice to what you're going to pick and choose. But the real stuff, not just like really actively listening to, I want to have all of the information now, not to sort it out myself later. And also, whatever you are experiencing, to have some follow-up recognition,
Yes.
active, validation. Yes, this is what you're feeling.
Right.
And you didn't get that
No.
sometimes.
No,
And
I
that
didn't.
urge to tell others, this is
Yes,
what's going to happen.
And that poor woman probably thought who was this nut bar?
Yeah.
But I felt it was really important to say to her, hey, you need to know this.
Yeah.
'Cause he's not sharing the whole story with you. And his intentions, I don't think, of course, were not, to leave out information. I just think he just simply doesn't understand.
And wouldn't know if they haven't gone through it themselves. Why it's so important to have someone who's gone through it to really highlight some of the main parts that we can't miss out on.
Yeah.
That's why this is so important. That's why we're so happy you're here doing this film with us.
Yeah.
Right?
That's great.
Yeah. Thank you.
So my name's Dani Whittle. I'm a radiation therapist, and I have a passion in supporting survivorship care for cancer patients. I'm also a clinical research coordinator for Interior Health as well, research department.
So in this cancer research study, what were the main objectives and outcomes of the study?
The main objectives were to model a prophylactic patient engagement and care system using a literature review of models. We wanted to explore patient perspectives and perceptions, experiences among women diagnosed with breast cancer in the community.
So what were the priorities of women when they make decisions regarding their own breast cancer treatment and their survivorship?
Some women prioritize survival above all else, and they may be willing to undergo aggressive treatments in order to increase their chance of survival. Others prioritize quality of life when making decisions about breast cancer treatments, and they were willing to accept lower survival rates for improved quality of life, as we know that side effects can have a significant impact on the participants' quality of life. So many participants wanted to prioritize treatments over having fewer side effects and less invasive treatments. And then also treatment can be kind of time-consuming, can take you away from your home as well. So it required participants to make some lifestyle changes. So prioritizing treatments that would actually fit with their lifestyle to limit those changes were important as well. Some patients also prioritize treatment to minimize emotional distress and anxiety. The expense of treatment can be quite expensive. So some participants may prioritize treatment being more affordable if they're able to receive their care and treatments closer to home rather than having to travel.
And from this research study, what are the recommendations for cancer navigation and cancer support from the people's voices?
So patients and caregivers have expressed several experiences with cancer supports and how these services have helped them. So some social media platforms and support groups. They can share links to resources of information and how to access these services as well. Patients and caregivers express that they can provide testimonials about their experience with cancer supports. Testimonials can be shared on healthcare platforms, organizations, social media as well. Patient advocacy groups is important as well and can help provide input on the development and promotion of cancer services within their kind of local community and also to the wider communities as well. And then this can just help ensure that the services are designed to meet the needs of the patients and the caregivers.
Okay, thank you very much, Danny, for being here and for talking and speaking towards what were the research outcomes and also the recommendations from the research study.
You're welcome. Thanks
Thank
for
you.
having me.